My name is Gail Giese. I want to tell you why I advocate with the Florida Mental Health Advocacy Coalition. My family's journey started 17 years ago in a neighborhood coffee shop called Java Island with my 12-year-old son. We would occasionally go there before school and get a coffee and a latte. Sometimes I'd help him study for a test. I loved those quality mother-son mornings. But on one of those occasions, he seemed unable to focus as I quizzed him. He was frustrated and said, "Mom, I'm stupid. I'm not like the other kids. I can't concentrate." And yet he was a smart kid in the gifted program. He loved geography and won the geography bee for his middle school that year. Sports came easily for him, especially baseball and tennis. He was musical. He played piano and was learning guitar. He was one of those nice kids who would pick up pencils if some other kid dropped them. He was a good big brother to his little sister. For such a kid, it was easy to overlook a lack of organization and focus that soon led to social anxiety. At 14, he wanted to avoid school and parties. I asked his pediatrician for help and was referred to a child psychologist. At 15, my son had a panic attack in the psychologist's office, and yet there was nothing prescribed and no follow-up treatment recommended. The panic attacks came more often, and at age 16, he resorted to self-medication, smoking marijuana, to get through high school. Then one fall day in his senior year, he had a big psychotic break, rendering him terrified and confused. Our lives would never be the same again. People told us that we were a smart family and we would see the right doctors and get this all cleared up right away. 17 years later, we're still trying to figure it out. This is why I advocate. NAMI, the National Alliance on Mental Illness, is right. We must advocate to ensure people with mental illness, number 1, get help early. Number 2, have access to good behavioral health care and supportive housing. And number 3, are diverted from the criminal justice system. Let's look at these 3 areas, starting with number 1, getting help early. Mental Health America says before stage 4. It's important for primary care doctors to be screening children and adolescents for mental health as recommended by the American Academy of Pediatrics. In Florida, I know of one pediatric practice that treats the brain and the rest of the body and provides mental health care in the patient's familiar pediatric home. On site, they have a mental health team that includes a certified psychiatric nurse practitioner, their care coordinator who speaks with pediatricians, mental health professionals, and teachers, is aware of local mental health resources and can refer if needed. We know that 50% of mental illnesses begin before age 14. This brain-body pediatric model sounds like a dream come true. This would have saved my family and so many others years of heartache. It also saves money by avoiding recurring hospitalizations, emergency room, and specialty visits. And it keeps saving because people with mental illnesses usually recover and lead productive lives if their condition is treated early. However, there is a cost to providing this high-quality care. These exemplary brain-body pediatric practices need to pay salaries and operating expenses and not lose money. Unfortunately, reimbursement from insurance companies is not guaranteed for mental health, despite having proper diagnostic and procedure codes. Denial of coverage is common. Services are often restrictive, not covering follow-up care. Examples include approval of only a limited number of specialist visits, limited medication options, mandatory step therapy, frequent formulary changes resulting in destabilization, and disproportionately high out-of-pocket copays for mental health care or psych medications. Payments for mental health and cognitive services are frequently lower than equivalents paid for physical health care services. Finally, payers commonly decline to pay or provide inadequate payment for care coordination Yet office staff and clinicians are asked to spend large amounts of uncompensated time communicating with parents, teachers, and other stakeholders. According to a recent American Academy of Pediatrics survey, 41% of pediatricians reported that inadequate reimbursement is a major barrier to providing mental health counseling, and 46% reported that they would be interested in hiring mental health clinicians in their practice if payment and financial resources were not an issue. This is why the Florida Mental Health Advocacy Coalition advocates for insurance parity, which I'll touch on more in a few minutes. Getting help early, before a psychotic break, is best. But if your loved one does have psychosis, which is a break with reality, find a first episode psychosis program. The federal government has studied the efficacy of these programs and has required states to spend a percentage of their mental health budgets on providing this life-saving treatment. At this time, Florida has 8 first episode psychosis programs. This evidence-based treatment is a game changer. It seeks to alter the course and prognosis of schizophrenia by providing rapid, comprehensive, effective treatment at the early stages of psychosis. Involving the family and a treatment team, first episode psychosis programs reduce the likelihood of long-term disability and help young adults get back to school and work. Let's look at number 2, providing access to care and housing. Mental Health America ranks Florida 48th in access to care. We have a lot of work to do. Let's start with the most essential need, a safe place to call home, a place to recover. We know that across Florida, people with mental illnesses and substance use disorders and their families are desperate for housing. How can treatment be effective if you're living under a bridge? Make sure your state legislators don't allow the money from the Sadowski Trust Fund to be used for anything other than for what it was intended, affordable housing. Safe and decent housing for households whose combined income is under 80% of the area's median income. Many populations need affordable housing. Supportive housing is a type of affordable housing. For people with serious mental illness who usually earn below 30% of the area median income, it's a critical cornerstone. Often having lost the support of friends and family and the ability to work or attend school, people with serious mental illnesses are an extremely vulnerable population at risk for homelessness. It is essential that they have permanent housing that includes supportive services on site to build life and social skills, manage money, provide vocational training, and physical recreation. Having a serious mental illness turns your life upside down, but it doesn't have to destroy your life because recovery is possible with the right supports. Additionally, providing safe, supportive housing is cheaper than paying for recurring hospitalizations, incarcerations, and homelessness. Ability Housing in Duval did a 4-year study comparing the costs of providing to not providing permanent supportive housing to individuals who require an abundance of crisis services and experience housing instability. Using pre- and post measures, Ability's Solution That Saves program found very significant savings in healthcare and incarceration costs. There was outstanding improvement in the lives of individuals while simultaneously saving taxpayer money. Indeed, it is cheaper for a community to pay for a whole year of intensive outpatient treatment, disability benefits, and housing for the same cost as one 94-day incarceration or one 19-day hospitalization for a person with mental illness. So let's say you have safe housing, but what if your insurance doesn't cover behavioral health treatment? The federal parity law says that insurers, both public and private, may not discriminate against mental health and substance use disorder patients by limiting the insurance coverage available to them, or by requiring them to pay more for the same coverage available to all other patients. An example would be limiting therapy appointments. Many people need therapy once a week to maintain good mental health as a preventative measure. If denied coverage, the patient's condition may worsen and lead to hospitalization, way more expensive than the cost of the therapy, or more tragic outcomes. Let's choose recovery, not relapse. The Florida Mental Health Advocacy Coalition advocates for insurance parity and asks Florida's Office of Insurance Regulation to enforce it. It's actually a bargain. For each dollar spent, about $1 is saved on welfare benefits and another dollar is saved on physical health care. Parity saves money because adequate treatment in the first place is less expensive than the higher cost of emergency services. Remember those wonderful pediatricians trying to provide both pediatric and behavioral health care so our loved ones with mental illness get treatment early? Let's make sure they stay in business. But what if you don't have health insurance at all because you can't afford it? FLMHAC is pleased to join Healthcare for Florida's coalition to expand Medicaid in our state. With Medicaid Expansion, low-income adult Floridians could receive immediate treatment for serious mental health conditions. Adults with untreated serious mental illness would no longer cycle in and out of emergency rooms, jails, and homelessness. Young adults experiencing their first psychotic episodes would have access to early treatment, reducing their risk of lifetime disability. Medicaid expansion is part of the Affordable Care Act that allows states to expand their Medicaid programs to cover all low-income adults. The federal government currently covers up to 90% of the cost. Florida is one of 12 states that did not adopt Medicaid expansion and yet has the third largest population of uninsured residents in the country. Florida could save nearly $199 million in fiscal year 22-23 by offering Medicaid health care to 1.2 million uninsured Floridians. The savings would come from offsetting state and local government costs in other areas, such as uncompensated care costs, emergency room visits, homeless services, and unemployment. By enacting Medicaid expansion, Florida can dramatically increase the number of people receiving treatment for their mental health. The data backs this up. Other states that expanded their Medicaid programs saw greater improvements in access to mental health services and medications, and a 44% average decline in uninsured mental health hospital stays. Medicaid expansion is good for Florida's economy. When a state expands its Medicaid program, state spending is replaced with an influx of federal Medicaid dollars, increasing our capacity to provide needed care while bolstering state funds, creating jobs, and freeing up additional resources. Access to care is a complex problem, but includes providing more effective crisis response services, such as call centers with 24/7 counseling that can deploy peer specialists and mobile response teams and can schedule follow-up appointments in real time. Cost-effective because it prevents use of emergency services and hospitalizations. 988, not 911, but 988 passed recently into federal law and will be functional in the summer of 2022. 988 will link to existing call centers, lessening the burden on 911. My favorite part of the statewide Georgia Crisis and Access line is the access part. We don't want to wait until a crisis to be able to access behavioral health care. We don't want to resort to Baker Acts. We want to provide treatment to avoid them. Let's look at diversion from the criminal justice system. That's number 3. An estimated 2 million people with serious mental illnesses are booked into local jails each year. Counties recognize the need for systems-level change to help them better link people to treatment while improving public safety in fiscally responsible and effective ways. Since the mid-20th century, the number of psychiatric hospital beds nationwide has decreased more than 90%, while the number of people with mental illnesses incarcerated in jails and prisons has increased by more than 400%. Once incarcerated, individuals with mental illnesses tend to stay longer in jail and upon release are at a higher risk of recidivism. Jails spend 2 to 3 times more money on adults with mental illnesses than on those without, yet often do not see improvements to public safety or these individuals' health. Without change, large numbers of people with mental illnesses will continue to cycle through the criminal justice system, often resulting in tragic outcomes for them and their families. What can we do? Well, did you know that each county in Florida has a public safety council? The Florida Mental Health Advocacy Coalition seeks to have behavioral health advocates serve along with behavioral health and criminal justice professionals on these councils to pursue collaborative county initiatives such as Stepping Up. Stepping Up is a national movement to provide counties with the tools they need to develop data-driven strategies that can lead to measurable reductions in the number of people with mental illnesses and co-occurring disorders in jails. Stepping Up engages a diverse group of organizations to collaborate: sheriffs, jail administrators, judges, state attorneys and public defenders, community corrections professionals, treatment providers, people with mental illnesses and their family advocates, mental health and substance use program directors, and county policymakers. FLMHAC encourages you to pursue the Stepping Up initiative in your county. I'm very pleased to report that the Broward County Stepping Up Initiative Task Force, started by NAMI Broward, was awarded a SAMHSA grant for workshops to kick off the initiative. I've talked about getting help early, having access to care and supportive housing, and diversion from the criminal justice system. These are essential needs, among others, being studied by the Florida Mental Health Advocacy Coalition so that we can propose improvements. My son and I still go for coffee sometimes, although Java Island is no longer there. Thankfully, he's never been involved with the criminal justice system. He approved this talk, and he's the bravest person I know, taking a handful of pills twice a day, some of which make him feel like a zombie. He has a certified peer recovery specialist who's a friend. He ignores intruding thoughts, tries to concentrate, wants to be independent. He is safe and has hope. But I know that if he'd received help from his pediatrician when he was 14, or the psychologist when he was 15, or participated in the first episode Psychosis program in his late teen or early adult years, his life would be better. So I tell my story to help others, and I ask you to do the same. Let's ensure that families know what to do when their loved one shows signs of a mental illness. Let's improve access to care and make it easier to navigate Florida's tangled behavioral health care system. Let's make sure treatment includes recovery-based services to engage people and manage their symptoms, focusing on their strengths, identifying goals for personal growth, and helping them pursue these goals. Peer-based services and clubhouses, like the Key Clubhouse in Miami, offer such programs. Most psychiatric care happens in jails and prisons. Let's change that and make sure those who do go to jail for nonviolent crimes caused by their illnesses are accepted into diversion treatment right away. This all makes sense economically. Why do we keep throwing money away on recurring emergency room visits, hospitalizations, incarcerations, and homeless services? Instead, let's fix our system. Everyone needs treatment for their brains as well as their bodies. Last I checked, they're connected. Recovery is possible, and people have a right to good health to pursue their dreams. They have a right to empathy and kindness without stigma. They are our children, our siblings, our parents, our friends. We advocate for them, and we empower them to advocate for themselves. What can you do? Visit flmhac.org and sign up for action alerts. Talk to your state legislators and local policymakers. Join your local NAMI, National Alliance on Mental Illness, or MHA, Mental Health America, and advocate. Thank you.